I'm Zach Wunrow. I'm a medical student at the University of Vermont College of Medicine. I'm between my first and second year, and I have decided to spend 6 weeks of my summer in Uganda, particularly at St. Stephen's Hospital outside of Kampala.
I chose to come to Uganda because it seemed like a place completely different than anywhere else I'd ever been before. I've never spent a significant amount of time in Africa.
I think I wanted to see some diseases that I would never be able to see in the United States. Things like malaria, HIV, tuberculosis have such a high prevalence here.
I was really looking forward to seeing how all of those conditions are managed in areas where resources are more limited than we see at home.
I also was really drawn to the Homestay component of the Uganda program, and how that works is you get to stay with a host family who educates you about the culture every single day, which I think is very special about this program, to be able to, at the end of the day, talk to the Reverend Sam Vogga about his thoughts about medicine, about healthcare in Uganda. And so that's been an absolutely valuable part. And as soon as we arrived, they were extremely welcoming to all of us. It felt like home. There wasn't confusion about figuring out, which apartment do we go to, how do we get to the hospital, how do we arrange transport. It was all figured out very nicely for us.
People's health truly starts in their communities and where they live and go to school, go to church, whether they have access to a facility, whether they have financial means to pay for treatment.
They've been very, very educational. It's been great to get the opportunity to put aside all of the year of textbook learning that we've been doing for a moment and kind of open our eyes to here's a community of people who have these medical conditions that we've only read about before, and how do we work with the person in front of us to help get them better. Goes on. There are a number of great educators at the hospital, lab technicians, clinical officers who are willing to help you out to better understand the disease processes. The community near St. Stephen's is a smaller area, not nearly as crowded or chaotic as Kampala. And so we walk through a lot of Imperaway on our way from the Lubboga's home to the hospital. And it's maybe a 10 or 15 minute walk. And it's a nice walk. We get the cries of Mzungu from passing children as we walk by, and that's very entertaining, if anything. But so St. Stephen's serves a fairly large area, and so for some patients it's not as easy as it is for us to walk over. They have to come in on boda boda, the name for the motorcycles, and sometimes that trip can be 10 kilometers, 20 kilometers, and especially if the mother's pregnant or if a patient is in a really bad state, it can be difficult. There is an ambulance at the hospital, and so we have gotten to go on house visits with the ambulance every Monday, and that's an opportunity to kind of go see patients at their homes who don't feel like they can ambulate easily to the hospital, and that's a very special part of a kind of a community hospital where you are able to make those visits to go see patients. So once our day ends at St. Stephen's Hospital, we make the walk back to the Lubboga's home, and we're very lucky to have the homestay opportunity that we do at the Lubboga's, because every night the family will be there. It's a large family with Adrian, who's now a 2-year-old who loves throwing toys but who is an excellent kid. And then you have the very wise Reverend Sam Vogga, who is kind of the head of the house, and his wife, Christine.
A lovely family, the Voggas, this whole time, and they've taken such great care of us.
They are wonderful to talk to because they'll always have some story about medical culture in Uganda, the differences between tribes, and there's an education just waiting to happen each night with them. And so they have kindly invited us to many of the activities that they are a part of. I got to go to church this past weekend with the Reverend, and he translated everything right next to me, which was very nice. And then the day before, there was a kuchala, which is it's kind of the introduction of the groom to all the aunts of the bride. And so that was great to be a part of because you got to see everybody have a little fun, and it's an interesting tradition that weddings are a multi-part process in Uganda, and so it was valuable to be a part of that for the day.
I thought the traditional dress, the gomeses, were beautiful. All the colors and patterns were very beautiful.
My name is Molly Moore. I'm a pediatrician working at the University of Vermont Children's Hospital, and I've had the privilege of working as a global health mentor with the medical students from the University of Vermont College of Medicine. My role here as a global health mentor has been to work with the students to ensure that they have an optimal educational experience and that they do not burden the local staff. The local staff have been very generous with their time and are excellent educators, and I hope to augment the experience. I've worked previously for several years in East Africa, and I enjoy returning to the beautiful country of Uganda, where I am able to work at this hospital, St. Stephen's. So during my stay here, I have hoped that I was able to contribute a little to the care of some of the pediatric patients. Other physicians and I have discussed cases. We've discussed sort of treatment options in the US versus here and what would be the optimal treatment in this setting. The country of Uganda has a number of excellent pediatric protocols that are followed regularly here at this hospital, but we discuss the complex cases together. Anytime there's a language barrier, it always provides obstacles to communicating with your patients. However, the staff here at St. Stephen's have been excellent at translating for patients who do not speak English, though a number of patients do speak English, as we have a very educated population here in Kampala. Interacting with patients here, we have learned a lot about local culture as well as traditional medicine here in Uganda and its interaction and complementary aspects with biomedicine here at St. Stephen's Hospital.
My name is Reverend Dr. Professor Samuel Vogga. This is our home in Perere, Namere. And this is the Homestay home where the students come from Vermont and stay with us. The current students, as always, they are extremely highly motivated, they're enthusiastic. It is you almost think they are. It is clear that they are very carefully selected. They have a great aptitude for international health. They're inquisitive. They like to connect with other cultures.
On Saturday we had an occasion where one of we call them daughters, my daughters, because she calls me an auntie. She came here to bring her husband to be, and we had a big do where we and my sisters came to meet the new husband, but we had the students with us and they enjoyed the day because when they come in, we introduce each other, and it is a formal occasion where we put on gomeses as the aunties. I told them not to put on gomeses because they are the children in the house. So they attended and they enjoyed the day.
They fit right in. All of us help them learn the local language, which is Luganda. We all explain to them the various aspects of our culture. We support them, we collect them from the airport, and we also learn from them aspects of their culture that we are not familiar with.
They have learned to eat whatever we eat. We eat matoke. This is green bananas. They have learned to eat it. We cook it with brown nut sauce, which is like peanut butter. I want people to be encouraged to come to us because we behave like a family. Everybody who comes becomes a family with us. We enjoy each other. Each morning we get up and we greet each other. We have breakfast together. The grounds are big and we have flowers. They enjoy looking out in the flowers. There are birds singing in the compound.
My name is Nosaka Sseba. I work as the international coordinator at Makerere University College of Health Sciences. My role is to organize clinical and research placements for visiting international students within the main teaching hospital Mulago and other affiliated hospitals across the country. I'm very privileged to work with the Western Connecticut Health Network because through the program I have seen the opportunities for junior faculty to be able to super specialize, which benefits clinical care in the main teaching hospital. And through the exchange, students from Makerere have been able to travel abroad and take placements within the consortium, which has enabled them to build capacity. And the visiting students from the network enrich the teaching and learning at the College of Health Sciences. I would like to thank the leaders at Makerere University for the great support they have given the program. We thank the principal, we thank the deputy principal for overseeing the implementation. I thank all the drivers that pick the students from the airport. I thank the host families, both in Uganda and in the US. I thank Professor Sadiq and all other faculty sacrificed their time to come and learn and teach and conduct research on behalf of their institutions and Makerere University. Thank you very much.